A recent study has raised some troubling concerns about the long-term effects of a commonly prescribed Parkinson's disease medication. While the drug has been widely celebrated for its ability to manage symptoms of the neurodegenerative condition, this new research reveals a potentially dangerous side effect that has been largely overlooked until now. Parkinson's patients who rely on this medication may be unaware of the risks associated with it, and the implications of this discovery could be more far-reaching than initially imagined. Parkinson's disease, a progressive neurological disorder, affects movement and often leads to tremors, stiffness, and difficulty with balance. Medications like levodopa have long been the cornerstone of treatment, offering relief from these debilitating symptoms. However, the new findings suggest that while levodopa can be effective in controlling motor symptoms, it could also carry serious unintended consequences that might outweigh its benefits. The study uncovered that long-term use of the drug might lead to cognitive decline and other neurological issues, even in patients who were previously managing their Parkinson's symptoms relatively well. This is particularly concerning for those who may have been using the medication for years without fully understanding the potential risks to their brain function. The research shows that levodopa, over time, could accelerate the process of neurodegeneration, affecting areas of the brain responsible for memory, learning, and emotional regulation. What makes this even more alarming is that the cognitive decline associated with the drug might not become apparent until much later in the treatment process, leaving patients and healthcare providers caught off guard. The gradual nature of the cognitive changes means that individuals may not realize they're experiencing negative side effects until it has already begun to significantly impair their quality of life. Another critical point highlighted in the study is that the cognitive side effects could be worsened when combined with other common treatments for Parkinson's disease. Patients often take multiple medications to manage the range of symptoms they experience, and the interactions between these drugs might exacerbate the cognitive decline linked to levodopa. This underscores the complexity of Parkinson's treatment and the importance of constant monitoring by healthcare professionals to ensure that the combination of drugs is not contributing to further neurological deterioration. The potential for worsened cognitive function has serious implications, as Parkinson's disease already takes a heavy toll on the brain. For many patients, cognitive decline can be just as distressing, if not more so, than the motor symptoms. Deteriorating memory and cognitive abilities can lead to difficulties with decision-making, social interactions, and independence, which significantly affect overall quality of life. It's vital that doctors carefully consider these risks when prescribing medications like levodopa and weigh the potential cognitive side effects against the benefits in each individual case. Moreover, the study also warns that the negative effects of levodopa on cognitive function may not be easily reversible. Once these cognitive declines set in, there may be limited options for recovery or mitigation, leaving patients with few alternatives for managing their condition. This revelation casts a shadow over the effectiveness of current Parkinson's treatments and suggests that the search for new therapies should be a priority. In light of these findings, patients who are currently taking levodopa, or who have been on it for an extended period, should be vigilant and proactive in discussing any changes in cognitive function with their doctors. Even subtle shifts in memory, attention, or emotional regulation could be indicative of more severe issues down the line. Regular cognitive assessments and close monitoring of any changes in behavior could help catch these issues early and potentially mitigate further harm. It's also worth noting that the medical community is still grappling with the full extent of Parkinson's disease and its treatment options. There's still much to be learned about how medications interact with the brain over the long term, and this study serves as a reminder of the need for continuous research and critical evaluation of established treatments. Just because a medication has been used for many years does not necessarily mean it is the best option for every patient, especially as new information comes to light. While levodopa remains a mainstay in Parkinson's treatment, this study serves as a wake-up call to both doctors and patients alike. The risks associated with the drug's long-term use could have serious consequences, and it is essential to consider alternative treatments or adjunct therapies that might offer better outcomes in the long run. The search for more effective and safer Parkinson's treatments must continue, with a heightened awareness of how medications can impact the brain in ways that may not be immediately obvious. In conclusion, while levodopa has been a valuable tool in managing Parkinson's disease, the new study sheds light on its potential cognitive side effects, which should not be ignored. The long-term use of the drug could lead to significant and irreversible brain changes that could affect memory, cognition, and overall mental health. Patients must be informed of these risks, and healthcare providers should adopt a more cautious approach in prescribing levodopa, ensuring that patients are regularly monitored for any signs of cognitive decline. Moving forward, it is crucial that the medical community prioritizes the development of safer, more effective treatments that don't come with these troubling side effects.